Hi, I'm John Morgan, one of the senior cardiologists here at Royal Melbourne Hospital. Today we're going to talk about coronary heart disease. Coronary heart disease is a build-up of plaque in the coronary arteries, commonly known as atherosclerosis. It's usually a build-up of cholesterol, which leads to blockages in the heart arteries and ultimately heart attack and death. Atherosclerosis comes in many forms. There are stable forms where there's blockages in heart arteries, which cause angina, such as the chest pain when you're walking, but also can cause heart attacks when a plaque in the artery ruptures and blocks the artery. Smoking, diabetes, high blood pressure, high cholesterol, and family history are the common causes of cholesterol buildup in the heart arteries. However, people can have none of these risk factors and still have atherosclerosis. 5% of Australians are living with coronary heart disease at the moment, and is the leading cause of death in Australia. The symptoms of heart disease can be many and varied. The common ones are chest pain and shortness of breath. Usually we would say angina is chest pain when people are walking or exercising, but people can have angina at rest, and people can have funny symptoms such as throat pain, abdominal pain, arm pain, jaw pain as angina. Typical symptoms tend to happen more in men than women. Shortness of breath can also be a symptom of heart disease, particularly in our diabetic population, can have shortness of breath rather than chest pain as a sign or a symptom of their blockages in their heart arteries. Chest pain is an important symptom of coronary heart disease. If you get chest pain when you walk and it goes away, that's fine, you can go and see your GP. But if you have severe chest pain that lasts longer than 15 minutes, you should definitely call an ambulance and come into the emergency department. There are a number of tests that we do. We usually start with a simple test such as an electrocardiogram. We then can do more simple tests such as ultrasounds of the heart to see if the heart is weak or if there's been any previous damage from heart attacks. We can also do stress testing, either with medication or on a treadmill or a bicycle. And we often do that with an ultrasound of the heart, what we call stress echo, or we also can do that with a nuclear study, such as what we call a stress MIBI. We can also do CAT scans of the heart arteries, which is a CT coronary angiogram, where we look directly at the arteries with a CAT scan, and that tells us whether there's been any cholesterol buildup. The definitive test is an invasive coronary angiogram, where we put a needle in either the wrist or the groin and inject dye down the heart arteries to see if there are any blockages. If you come into a hospital with chest pain, we will do an ECG and some blood tests. The main blood test we would test is troponin, which is an enzyme which is released from the heart if there's any damage to the heart. This is the ECG, which is the simple test we can perform by putting 10 sticky dots on the chest. It gives us a lot of information about heart rhythm, but it can also tell us whether there's been any blockages of the heart arteries or whether there's any coronary heart disease. This is a patient who came into the hospital yesterday, and we can have a look in here. There are various areas of the heart we can look at, the bottom part of the heart and the front part of the heart. And we can see some changes in this area which suggest that the patient has a blockage in the artery that comes down the front of the heart and that they would need to go ahead and have an urgent angiogram. This is the angiogram of that patient who the ECG we just looked at. The ECG was suggestive that there was a blockage in the heart arteries. As we can see here, coming down the front of the heart, the artery stops abruptly here. It should be filling all the way down here to the tip of the heart. So this means that this artery needs to be unblocked urgently. So we'll put down a wire and then a balloon and then a stent to hold the artery open.